I'm Dr. Truesdale. I'm a double board certified facial plastic surgeon and I work in Beverly Hills, California. Forget what you know. I'm here to show you the real. What is it really like to be a plastic surgeon? What is it really like to take someone back in time? To make them look different, to make them look prettier, or just to give them a boost of confidence with a subtle enhancement. I perform anything in the face. I mean, I do it all. Hair surgery, facelifts, nose surgery, anything that you can think of to make a person's face or neck look different, that's my jam. I'm pulling back the curtain on my practice to show you the real people, the real procedures, and the real results. This is about real life journeys, inspiring transformations, and the power of feeling confident in your own skin. We'll explore everything from subtle enhancements to life-changing transformations. I'm gonna share my story, the stories of my patients who've entrusted me with their faces and their dreams. Almost no one knows how stressful my job is, but the moment when someone sees their new reflection, that's why I do this. Because changing someone's face can change their whole life. This is beyond the surface. It's been 3 years since I've been in Los Angeles in my own practice, and it's been a dream come true. Not only have I been able to open up one office, but now I have two. And the second office, I have my own operating room. Being a plastic surgeon is not for the faint of heart. Basically, I hold up a lot of people's lives, not only mine and my family, but all of my patients. There's a lot of pressure. I have to take care of people, and every single day, people ask me to cut their faces, to make them look prettier, younger, and better. That's a lot. Not only that, I'm running a practice in the most competitive place in the world, Beverly Hills, and I'm doing this for the world to see. All eyes on me. I'm ready for the pressure. Let's go. Hello. Welcome back.
Thank you.
I'm super excited. We're doing surgery soon.
Yes.
All right, so my next patient is Charlotte. Charlotte is a sweetheart. She's a native to Los Angeles and she's 63 years young.
My name is Charlotte Burns. I'm 63 years old and I have retired from law enforcement. So I'm going to have a neck and facelift, upper eyelid surgery, and another procedure that will help even out my smile. So I had 3 brain surgeries. The last one in 2021 left me paralyzed on the right side of my face. And so the procedures will hopefully make everything more even.
So in your own words, what would you like to kind of change?
I should take these off.
Yeah.
I'm looking for more symmetry in my face since the right side was paralyzed. I'd like everything to maybe line up better. Even here, my neck, the right side is droopier than the left side.
Yeah.
I'd like to address my eyelid,
Yeah.
the upper eyelid
Blepharoplasty.
blepharoplasty. I've been working on that word.
Just think of it as an F. Bleph.
Bleph.
Yep.
Full
Yep,
breath.
there you go.
And then my mouth, of course, the right side doesn't open. So we talked about just adjusting it and maybe getting the surgery so that it lines up a little
Weaken that nerve, yeah.
Yes,
and we did the little test.
Yes, and that worked great.
How long did it last?
Honestly, I don't remember, but I think a few days later, I was like, oh my God. After my last brain surgery in 2021, and I did get the majority of my movement back on the right side of my face. However, it didn't come back completely. And that's when I started thinking about maybe looking into plastic surgery to see if anything could be done about it. So I've been looking since then. I never made any steps toward it because I didn't know where to go and I didn't know any plastic surgeons, nor did I know anyone who had plastic surgery. So when I stumbled upon his site, that's when I really started looking at it and made the decision to go forward.
So yeah, we did the little injection to test out weakening the side that actually works better to make more symmetry. You liked it.
I did.
So that's what we're gonna do. We're gonna do a selective neurectomy. So basically the little nerve that comes down to the lower lip, on this side, it's not working as strongly after everything that has happened. So if I weaken this, when you smile, smile big, basically this one's gonna come up a little bit more, be more symmetric, just like that. So this little muscle's pulling down. So that's gonna be a nice little addition. Charlotte wanted to get a new refresh. Charlotte has been through a lot. She's had some surgeries, some brain surgeries, and she's had multiple of those. So really she wanted to have a surgery that really just made her feel better. You know, some of the issues that she's had neurologically has caused some weakness on the right side of her face. And on top of that, she has a little bit of obstructive sleep apnea. So, you don't know this, my background is ear, nose, and throat surgery. I'm a head and neck surgeon, and I used to do sleep medicine surgery. So if you have obstructive sleep apnea or difficulty breathing, I used to do that kind of stuff. So yeah, we're gonna clean up your eyelids. If you look in the mirror, all of this extra skin is gonna go bye-bye. A little bit of that extra fat. Obviously, the main force is gonna be bringing all of that up, and then the neck, really crisp like that.
Yes.
And what
so
else?
I have this dimple now since this side is paralyzed. I didn't have before. So I don't know if that will be gone.
Purse your lips like this, and then show me your bottom teeth, and then relax. I'm taking a little bit of fat from you, right? Am I doing a little bit of fat transfer?
Yeah, you mentioned
so I can try to put a little bit of fat in this area to try to plump it up. Ultimately, what's going on here is the fact that the muscle, the nerve isn't working as strongly, so the muscle may have atrophied a little bit in this area. So I want to plump it up a little bit to create a little bit more symmetry like that. So yeah, we'll address that.
That'd be great.
Yeah. Easy peasy. So yeah, it's gonna be great. You're gonna look fantastic. Do you know which nurse is taking care of you?
Rachel.
Perfect, you're gonna love her.
Hi, my name is Rachel, and I'm the Director of Nursing for the True Surgical Center downstairs.
When I started plastic surgery, it was just me. Then it was Juliana, then it was Maria. Basically now we're at Vanya, new front desk, we have Jezreel, we've got Cynthia, we've got Cleo P, and you know, it's been so amazing to be able to be their boss and enjoy kind of, you know, the family that we create in the office. And then this muscle, because this muscle isn't getting, we spoke about it, but because this muscle isn't getting as much innervation, it's low. And so I'm gonna bring it back up so that they're more symmetric, the two sides, like that.
Keeping in mind that I have the
hypoglossal nerve stimulator.
Thank you.
Yes, I remember. So hypoglossal nerve stimulator is a really fun procedure because you basically create a pacemaker for the tongue. So every night when you sleep, and if you have obstructive sleep apnea, all of the tissues in the back of your throat collapse, and that blocks the air. That makes you snore, and it makes you not have a restful night and causes other issues. So what we do is we actually hook up electrodes to the hypoglossal nerve, the nerve that helps us extend our tongue. And what we do is we actually then hook another sensor up to the chest wall. And that sensor monitors if you're breathing in or out. And every night we turn this thing on, and what happens is when you're going to inhale, right, which would otherwise block your airway, it sends a signal from that pacemaker to that nerve, and it causes the tongue to just scoop forward a bit, which opens up the back of the throat. So it's a really amazing technology, but I knew that I would have to navigate this because it's in the neck. The electrode goes from the tongue nerve, all the way to the chest wall. And so it's a little bit tricky. And I knew that when I'm in the neck doing my surgery, I would have to try to avoid it because God forbid if I cut that little electrode, her hypoglossal nerve stimulator wouldn't work anymore, and it would be very challenging, if not impossible, to actually repair it if I had to go back in. So that was a very complicated little piece of the pie that I had to figure out for her. So I'll be looking for it. I'm gonna stay away from it because I do not want to clip it. Usually, so I used to put those in for people who have sleep apnea, and we plug it into the nerve that helps control sticking the tongue out. And so every time it's like a pacemaker for the tongue. But when we take basically the sensor that goes in the chest wall, we tunnel it up through into the nerve that goes in the tongue that comes in about right here. So when I'm doing everything that I'm doing, I'm gonna look for that and stay away from it so that I don't cut that, so that it still works.
Great.
So, but I'll have to be careful.
But I think for me, when people look at me, they say, oh, I don't notice anything, or you can barely notice, or, you know, it doesn't look bad. but I notice. And so plastic surgery is something that you really have to do for yourself. And I notice that my smile is only half a smile, or when I speak, it's lopsided. So I look at that every day. And so I think plastic surgery is just a very personal thing you have to decide to do for yourself. And I'm just making the investment in myself.
How do you think your life is going to change after?
I think my life will change just for me.
Yeah.
Because they love me how I am.
Yeah, it's your life.
So
for you, how do you think it'll change for you though?
I'll be happier. I think, sorry.
It's okay.
I think it's nice. I think it's nice to be able to smile and not be concerned that it's crooked.
Mm-hmm.
So, yeah, little things.
I'm gonna do that for you, my friend.
I'm sorry.
It's okay. You've been through a ton. And so I'm happy to be a part of your recovery, honestly. And the side effect is you're going to look younger as well.
That'll help.
Yeah, it's going to be great.
That'll be good, yeah. So it's all about me. I'm being selfish, but I figure, I worked hard on my life, and retirement didn't work out the way I had it planned with the brain surgeries again. But it's getting better. I'm turning the corner.
Yeah.
And yeah, that's it.
Well, let's make the full corner turn.
Yes.
For sure.
Absolutely.
So part of the things that I need to do for her are not just cosmetic. Part of them are actually reconstructive. Part of her surgery is going to involve lifting up the eyelid with a blepharoplasty, but a special little part of that is something called a ptosis repair. Sometimes what we need to do is actually tighten that muscle up. It's a different muscle, but it brings up the curtains of the eyelid. And in her case, I'm gonna accomplish that. The other special part of her is because she has weakness and asymmetry in her face related to her nerve injury and her brain, what I'm gonna do is actually weaken the other nerve on the good side. So we are planning on doing a upper blepharoplasty with ptosis repair, a lower lid surgery, and also I'm going to tighten up the lid there, a face and neck lift, and fat transfer, all while watching out for her hypoglossal nerve and doing a selective neurectomy. She's going to look amazing, and it's going to restore her confidence and give her back a little bit more than just cosmetic, a little bit of reconstructive that she's lost with her previous brain surgeries. So Charlotte's coming back for her follow-up today. It's been 1 month since surgery. I'm very excited because she's going to be renewed. A lot of the things that we did for her both help with reconstruction, cosmetic, but also function, right? So I'm really excited to see how her journey's been.
Come in.
Hello, welcome back.
Nice to see you.
Good to see you. Welcome back in. How are you feeling?
I'm feeling great.
So remind me, are we 2 months?
About a month and a half.
A month and a half from your surgery.
Yes.
So how was the experience for you?
It was good. I didn't think it was as painful as I thought it would be.
Mm-hmm.
I think the weirdest thing was the numbness afterwards.
Right.
You have to wait until all of your feeling come back. So that's the longest part of the process.
Right. Do you feel like everything's back to normal, or do you still? It's normal to still feel a bit numb at this point.
I feel numb there.
Yeah.
Yes.
Yeah. Usually you start to get the sensation in the cheek here, and then it progresses towards the ear.
So it's about right here now.
Yep.
And it's moving backwards.
Yep.
Yeah. To me, plastic surgery can give you your life back, right? As you get older, I'm 63, as you get older, things start to change. And it just gives you a little more control on how you want to look going forward.
We did a bunch of special little things for you. Let's review all the things that we did. So we did an upper eyelid surgery, we did a lower eyelid surgery, and a special way to actually suspend up the eye so things are a little bit more even.
Yes.
How do you feel about that? Yeah. You like that?
Yes, I definitely think it looks better than
Beautiful.
it was.
And then the cheeks and the face, everything's lifted up. So, I mean, in terms of the facial contour, your neck looks great. You know, this part was tricky because of your hypoglossal nerve stimulator.
Yes.
So I had to avoid this. That was really, I was nervous. So I was like, I do not want to cut the little monitor.
Yes.
And it's still working.
Yes.
Good.
It's still working.
So it's a big step to undertake plastic surgery, right? It's a big financial burden, but also she's had 3 previous brain surgeries. Brain surgeries, guys, that's serious business. So to choose to do another surgery, I don't take that lightly. I had to take good care of her. She's had a great outcome, and we're able to actually restore some of the issues that she's had, both function and form. So, you know, this is all feel good because I get to use both sets of muscles, the reconstructive side and the cosmetic side, bring them together to help a patient. It's a plastic surgeon's dream.
It was frightening to make this huge monetary investment in myself. Part of the voices were, this is a waste of money. I mean, what are you doing? Because I'm used to saving. So I had to get past all that. You know, I was always caught up on finances and businesses and properties and doing all these little things. I don't need any more properties. I don't need any more things. And I just need to enjoy life and slow down. I can slow down. I've been retired for 5 years. I don't have to do anything else. I'm good. I finally did something for myself. The first thing I did for myself was put a pool in my backyard after years of wanting one, right? And then I did this, and I'm like, okay, finally I worked all my life. I'm gonna spend my money on me while I'm living and enjoy life, and that's what I'm doing.
On the next episode of Beyond the Surface, there are usually 2 ways of making this look better. So one would be orthognathic surgery, breaking the bones and moving this forward. What are we talking about?